Good afternoon or evening, Dr. Williamides. My name is Ursula Akem. I'm one of the students in your class. I'll be glad to do my presentation today. My two case studies are going to be all about the medication haloperidol, also called Hadol, which is a first generation antipsychotic medication. To begin my presentation, my objectives, this presentation will explain the mechanism of action of Hadol, case studies on appropriate prescription, discussion on the case studies. Hadol is a first generation antipsychotic and works on the dopamine receptors in the brain. This high potency medication acts primarily by blocking polysynaptic dopamine receptors in the mesolimbic system of the brain. Hadol is mainly used for the treatment of schizophrenia and psychosis. Schizophrenia is a thought disorder in which neurotransmitter abnormalities are central. Genetics, environment, stressors, and some illicit drugs can be contributing factors to this condition. Antipsychotics target the positive symptoms. Uh, the positive symptoms. Mechanism of action of this medication. Hadol is a butyrophenol antipsychotic that non-selective blocker receptor 2 in the brain. Hadol is 50% to 60% metabolized in the liver by the hormone glucuronidase, 23% CYP3A4 mediated reduction to inactive metabolites. Hadol is readily absorbed with a bioavailability of 60 to 70%, with peak concentrations occurring 30 minutes to 1 hour after administration, according to MedZ 1991. What it is used for? Like I said before, it is used for the treatment of schizophrenia and psychosis. It is typically used to take the vocal outbursts due to the Tourette syndrome, agitation, aggression associated with psychotic disorder, that is the schizophrenia. Substrate intoxication and other causes have clear indications for the use of Hadol. Other indications may include bipolar, delirium, nausea, and vomiting in terminally sick or ill patients. Hadol is used for chemotherapy-induced breakthrough, nausea and vomiting as alternate therapy, insomnia, anxiety, depression, post-traumatic stress disorder, obsessive compulsory disorder, personality disorder, autism, agitation, and dementia. The usual dosing for adults is about 0 to 2 milligram to 2 milligram, 2 to 3 times daily, increase gradually based on response and tolerability up to 30 milligram day in 2 to 4 divided doses for oral formulations. Some patients may require up to 5 to 10 milligram a day for optimal response with the IV formulation Hadol. Comes in a tablet. It can also comes in injection form. And external release suspension for IM injection. Usual side effects of this medication will include fatigue, anxiety, constipation, dry mouth, vomiting, diarrhea, lack of appetite, acne, agitation, trouble sleeping, CNS depression, dystonia, askenesia, restlessness and anxiety, in the ability to remain still, and the ability to remain still, and tardive dyskinesia, abnormal facial movement, primarily in the tongue or the mouth. This is not a complete list of side effects. Hence, patient must consult a primary health care with any concerns that they have. That brings us to case study number 1. Case study number 1, identifying the data. Name of this patient is John Doe. Age, he is 35 years old. Sex is a male. Race, African American. Religion, a Christian. Chief complaint of this patient is hallucination, delusion, disorganized speech, palpitation, difficulty concentrating, lack of eye contact, flat effect. Case study continue. Social history of this patient. John Doe is a single African American male who lives by himself, never was married, has 2 sisters who are in another state, and he is financially insecure. denies social isolation and does not share his anxiety with family and friends, so he is not considered weak. Physical exam. His vital signs are 98.7, 89, 120 over 74 for blood pressure. Respiration is 22. His pain level is on the pain scale is 0 out of 10. He's at 98 room air, 180 pounds his weight, and his height is 7.7. That brings us to BMI of 28.2. Mental status on exam. Disorganized, full range of motion, clear speech. He's in a euthymic mode. Responses are neither logical nor coherent, delusion or suicidal ideation, hallucination or illusion noted, alert and oriented times 4, alternative to details with no impairment. Case study continue. GAD7, he scored 19, answering 304 or the first 4 questions, feeling anxious and nervous, not being able to stop, control worrying, and other symptoms. Differential diagnosis are hallucination, outburst, psychosis, situational anxiety, delusion, anger, and depression. Treatment plan for this patient, they did all the diagnosis, the labs, CT scan, and all the BMP all together were done. Patient education, this medication to be taken only as prescribed, or common side effect is drowsiness, so alcohol should be avoided while taking. So all this teaching will be given to the patient prior to prescribing the medication. Discussion. Haldol is a good choice for the medication for this patient because the medication is effective in the treating schizophrenia and psychosis and based on the patient age. Another thing to consider would be patient's cultural influence. African American not more likely to go to the physician on time, and patient will be educated and convinced on that about the importance of this medication. John keeps things to himself because of the fear of being labeled in his community, so they might not want to share their diagnosis. So all that will be discussed with the patient prior to prescription. So the medication is very appropriate for the patient. For case study number 2, patient will be CJ and his age is 82 and he's also a male, but his race he's a Caucasian, not an African American. So his wife is of late and he and is giving him orders, keeps giving him orders. As a retired MD, CJ wants a low dose of Haldol for his symptoms. History of present illness, CJ complaining about the late wife giving him orders. Patient wants Haldol to treat his symptoms. That does not have any allergy. Past medical history, CJ is one of the following medication. He's on aspirin, on furosemide, and many others. He was in the emergency room 2 days ago, and the doctor saw the doctor and for heart medication and all that. So the patient complained with his medication, but says that he might soon need help. Pain ranges from 3 to 6. And he uses capsaicin. Past psychotic history, he takes escitalopram for depression. Family history, he's a widower and has father of 2. Physical exam, he's in acute distress. Blood pressure is high, and heart rate is normal. Chest and no abnormalities in the lung. Respiratory wise, he's fine. Mental status on exam, full range of motion, and everything was done. Differential diagnosis hallucination, of course, situational anxiety, hypertension, generalized body pain, post-traumatic stress disorder. Soft tissue injury, left wrist coil fractures, those are all part of his diagnosis. Medical tests were all conducted for this patient. We will offer him counseling. I will offer counseling. We'll continue with escitalopram 5 mg daily instead of 10 mg. CBT therapy, OTC Tylenol will be given, melatonin 3 mg, and we'll follow up in 2 weeks. Patient education, no alcohol with education, and to take all medication as prescribed. Patient is not a candidate for Haldol based on his age, the black box warning of the medication. Patient is with a sometimes manifested diagnosis of sepsis and UTI and confusion. It will be very important to do thorough assessment before giving any other prescription to CJ. Also, Haldol will interact with most of CJ's medication, not making it a good choice. References, you might see my references below. Thank you very much for my presentation. Thank you.